Margaret Calloway did not look like someone with a past worth knowing. She was soft-spoken, wore no jewelry, and kept her dark hair pulled back so tightly it made her look stern, though her eyes told a different story. Those eyes were warm, careful, and always watching. She arrived at Riverside General Hospital on a Tuesday in early October, carrying a small bag and a transfer letter signed by a regional medical board. She was 34 years old, single, and had worked in places most nurses never see on a map. The hospital was large, loud, and always moving. Doctors rushed through corridors with clipboards tucked under their arms. Orderlies pushed beds around corners. Phones rang constantly. For most new staff, the first week was overwhelming. Margaret walked through it all as if she had spent her whole life in rooms noisier than this one. She was assigned to the general medical ward under the supervision of Dr. Harold Voss, the hospital's chief of medicine for the past 11 years. Dr. Voss was tall, silver-haired, and had the kind of confidence that filled a room before he even opened his mouth. He had trained at 2 of the country's best medical schools, had his name on a dozen published papers, and made sure everyone around him knew it. He was not unkind exactly, but he was precise about hierarchy. In his hospital, doctors spoke and nurses listened. That was the way things worked, and he had no interest in changing it. Margaret did not challenge this arrangement on her first day, or her second. She arrived early, worked quietly, and did everything that was asked of her. The other nurses liked her quickly. She had a natural gentleness with patients, the kind that cannot be trained, and she never complained about the difficult cases. If anything, she seemed most at ease with the patients everyone else found hardest to help. The first moment of tension came in the second week. A patient named Gerald, 61 years old, had been admitted with chest pain. Dr. Voss had reviewed his file and ordered a standard course of medication for what he believed was a cardiac inflammation. Margaret had been present during the assessment. She said nothing then. But that evening, reviewing Gerald's chart at the nursing station, she noticed something. His pattern of symptoms, the timing of the pain, his blood pressure readings across the day, the small tremor in his left hand that the chart mentioned only once, did not match what Dr. Voss had diagnosed. She went to the charge nurse, a kind older woman named Rosa, and shared her concern. Rosa listened carefully and told her, gently but firmly, that Dr. Voss had reviewed the case and made his decision. Margaret nodded and thanked her. She went home that night and did not sleep well. The next morning, she arrived early and requested a brief meeting with Dr. Voss before rounds. He gave her 4 minutes. She presented her concern clearly, without drama, pointing to the specific readings and explaining her reasoning. Dr. Voss listened with an expression that did not change. When she finished, he told her that her concern was noted, that Gerald's case was being managed appropriately, and that she should return to her assigned duties. 3 days later, Gerald was rushed to the intensive care unit. The diagnosis was revised. He had been misread. The treatment was changed, and Gerald, fortunately, recovered. But it took 2 additional weeks, and a level of intervention that would not have been necessary if the correction had come sooner. No official report named the misdiagnosis as avoidable. No memo was written. But the nurses on the floor knew. The residents knew. And Dr. Voss knew. He did not confront Margaret. He simply began watching her. The second incident was smaller but more visible. During a morning procedure, Margaret noticed a dosage error about to be administered to a post-surgical patient. She spoke up immediately, quietly but clearly, in front of 3 people. The error was caught. The patient was safe, but the resident who had written the dosage was one of Dr. Voss's favored protégés, and the correction, however professional, had happened in front of others. After that, Dr. Voss began keeping a record. He documented a morning when Margaret had been 2 minutes late returning from break. He logged a week when she had asked a senior physician a question he considered outside her lane. He noted a single instance when she had rearranged the supply cart in the treatment room without informing the charge nurse in advance. Each item on its own was nothing. Together, they built a file. 6 weeks after Margaret's first day at Riverside General, Dr. Voss called her into his office on a Thursday morning at 8:15. He closed the door. He sat behind his desk and placed a thin folder between them. He spoke professionally, even warmly, but the words were precise and final. He cited insubordination. He cited failure to follow established protocol. He cited disruption to departmental workflow. He thanked her for her contributions and told her that her employment at Riverside General was terminated, effective immediately. Margaret looked at him for a long moment. She did not raise her voice. She did not argue. She asked if she could say goodbye to her patients. He told her that would not be appropriate. She stood, picked up nothing, and walked out. Rosa watched from the nursing station as Margaret crossed the floor. Their eyes met briefly. Rosa's mouth opened slightly, as if she might say something, but Margaret gave her a small, quiet smile, the kind that says I'm all right, even when it is hard to believe, and she kept walking. She collected her coat and her small bag from the staff locker room, signed out at the front desk, and walked through the automatic glass doors into the gray October morning. The hospital floor hummed on as it always did. Phones rang. Charts were updated. Dr. Voss returned to his rounds. For a while, nothing seemed different at all. 2 hours and 19 minutes after Margaret walked out of Riverside General Hospital, the front entrance opened again. 18 men walked in. They wore United States Army dress uniforms. Every jacket was pressed to a sharp edge. Every button was polished. Across their chests, in neat rows, hung medals, the kind that take years to earn and carry the weight of things most people never have to experience. They moved together with the quiet, unhurried certainty of people who had learned, through hard experience, that panic changes nothing. The lobby slowed around them. Nurses paused. A doctor stopped mid-sentence. A man waiting near the reception desk lowered his newspaper without realizing he had done it. The 18 men crossed the floor to the front desk, and their spokesperson, a broad-shouldered man in his early 40s with close-cropped gray at his temples, leaned slightly forward and spoke clearly. "We're looking for a nurse named Margaret Calloway. We were told she works here." The receptionist, a young woman named Diane, blinked. Yes, she does. Or she did. She was let go this morning, actually." The man at the front was quiet for a moment. He glanced at the others behind him, then back at Diane. "Could someone speak with us about that? Someone in administration?" Word moved through the hospital the way it always moves in small, contained spaces, fast and quietly, and through every room at once. Within 10 minutes, the lobby held not just the 18 soldiers, but a growing group of staff who had drifted in from the wards, from the break rooms, from the corridors above. People stood near the walls. Nobody seemed to want to leave. The hospital administrator, a measured man named Mr. Albright, came down and introduced himself. He led the soldiers into the large conference room just off the lobby. Dr. Voss was summoned. Several board members were called in. What followed was not a confrontation exactly. It was more like an account, a record being read aloud to people who did not know it existed. The man who had spoken at the front desk was Colonel James Whitmore, retired. He had served for 23 years. Beside him sat men of different ranks and different ages, but they all shared something in the way they held themselves, a particular stillness that comes from having been through things that cannot be undone. Colonel Whitmore spoke evenly. He explained that 3 years ago, in a region most people in this conference room would struggle to find on a map, a small convoy had been struck. 7 soldiers were critically wounded. 2 others had minor injuries. Communication had been lost. Evacuation was delayed by weather and conditions on the ground for over 6 hours. They had 1 medic with them. Her name was Margaret Calloway. She had been serving as a civilian field medic embedded with the unit under a specialized support contract, a quiet, unglamorous role that most people never hear about. She had no weapon. She had the supplies in her kit, her training, and the 6 hours ahead of her. She had worked without stopping. When her kit ran short, she improvised. When one soldier's condition deteriorated, to the point where most people would have stepped back, she stepped forward. She made decisions that field surgeons debate in classrooms. She kept 7 people alive until the helicopters finally came through the weather and found them. Colonel Whitmore paused at one point, not for effect, but because even now, the memory required a moment to pass through cleanly. 2 of the men in the room, sitting 3rd and 5th from the left along the conference table, had been among those 7 soldiers. One of them, a younger man with a deep scar along his left forearm, pressed his hands flat on the table and looked at the wall for a moment as the colonel spoke. "She never filed for recognition," Colonel Whitmore continued. She did not seek any documentation of what happened. We tried, after the fact, to ensure some formal acknowledgement reached her. She declined each time. She said she had simply done her job. The conference room was completely silent. We found out this morning, through a mutual contact, that she had been working here. Several of the men in this room had been trying to locate her for over a year, simply to thank her. When we heard what happened this morning, we came. Dr. Voss sat at the far end of the table. His hands were folded in front of him. His face did not show much, but his eyes had changed since the colonel began speaking. Something in them had gone very quiet. Mr. Albright spoke carefully. He asked several questions. The colonel answered each one without embellishment. The man with the scar on his forearm spoke once, briefly, just to confirm something the colonel had said. His voice was steady, but it cost him something to use it. After the meeting, Mr. Albright stepped out into the hallway and made a phone call. Margaret was at home, sitting at her kitchen table with a cup of tea she had not drunk, when her phone rang. She listened. She said very little. When Mr. Albright finished speaking, she was quiet for several seconds. "All right," she said finally. "I'll come back." When she walked through the doors of Riverside General for the second time that day, the lobby was full. She stopped just inside the entrance, and for the first time since anyone at that hospital had known her, she looked uncertain, not frightened, but unprepared, as if kindness had caught her off guard in a way that danger never had. The 18 soldiers stood in 2 rows, forming a corridor between the door and the center of the lobby. It had been organized quickly, without much discussion. They had simply moved into position the way people do when they know, without being told, what the moment calls for. Margaret stood still for a moment. Then she walked forward. She shook each hand. She looked each man in the eye. She called several of them by name, first names, quietly, with no ceremony, and each time she said a name, the man she said it to seemed to stand a little straighter and go a little softer at the same time. When she reached the young man with the scar on his forearm, she stopped. He looked at her. She looked at him. Then she put her arms around him and held on, and he held on too, and nobody in the lobby made a sound. The staff who had gathered around the edges of the room stood watching. Some were crying without quite realizing it. Rosa stood near the nursing station doorway, her hands pressed together at her chin. Dr. Voss stood at the far side of the room. Nobody had asked him to be there. He had come on his own. He watched everything, and he did not look like the same man who had sat behind his desk that morning with a folder and a prepared statement. He looked like someone who had been asked a question he did not know how to answer. In the days that followed, the hospital's board conducted a review of the termination. The finding was quick and clear. The documented reasons did not meet the threshold for dismissal. Margaret was reinstated with a full apology delivered in writing and in person. Her record at the hospital was cleared. Dr. Voss stepped down from his role as chief of medicine voluntarily, before the review board requested it. Though the request was already being drafted, he remained on staff in a reduced clinical capacity. He did not speak publicly about what happened, and he did not speak privately about it either. What he did, quietly, 3 weeks later, was stop by the nurses' station on the morning shift and ask Rosa if Margaret was in. When Rosa said yes, he nodded, walked to the supply room where Margaret was completing an inventory, and stood in the doorway. Margaret looked up. He said, "I was wrong." 3 words. No additional explanation. No list of qualifications or caveats. Just that. Margaret looked at him for a moment. Then she nodded once and turned back to her work. He left. She stayed. Margaret Calloway was appointed head nurse of the trauma unit the following month. She was, by every account, exactly the right person for it. She continued to arrive early. She continued to ask questions others were afraid to ask. She continued to work with the kind of quiet, relentless care that does not seek recognition, because the work itself is the point. None of her colleagues ever fully understood what she had been through before she arrived at that hospital. She never explained it. She did not think it needed explaining. She had seen what human beings are capable of enduring, and she had seen what they are capable of giving to one another in the middle of the worst moments of their lives. She had chosen, a long time ago, which side of that she wanted to be on. She showed up every day, and she stayed there.